Now, unfortunately, for people who are non-doctors, they don't have the privilege of finding out this inside information. Reading when the reviews have been written. If there are reviews which have been written about 5 years back or 1 year back and nobody has written anything after that, you'll have to question why. You meet the doctor irrespective of the lack of medical knowledge you have, not having any tools to assess the doctor. You sit in front of a doctor, the doctor starts talking to you. You know that you've reached the right doctor, or you know that you've reached the wrong doctor.
There's one doctor for a surgery, he'll charge you say 20,000. The other doctor will charge you 30,000. We tend to feel that the 30,000 one is the better one.
So in Dubai, it is not so much of a matter because Dubai, most of the patients are covered by the insurance.
Yeah.
And they might get away without seeing a doctor. But sometimes they might miss out on important things which should have been investigated earlier.
Hello everybody, this is going to be my favorite episode of Womanaari because I'm going to be asking Dr. Usha some of the most googled questions, on how to find the right doctor, what are people doing these days. So let me start by asking you, how do you choose the right doctor for yourself? Do you go on recommendations of relatives, family, friends and so on? Do you go to the latest doctor in town, that is ChatGPT, to ask which is the most trusted doctor around? How do you do that? This and with this many other questions, common mistakes that you and I make on a daily basis, and what should we do and not do? Let's talk about that with Dr. Usha Kiran, our consultant gynecologist in the room. Hi Dr. Usha, how are you?
Hi Diksha, I'm good, thank you.
Great. So, doctor, these are some of the most googled questions because this is what we're in today. How do you recommend choosing a gynecologist for yourself? 4 options. We look at qualifications, years of experience, a hospital reputation, or primarily go on personal recommendations.
And you left out the reviews.
Of course, Google reviews, which is going to be number 5, yes.
Okay, I think there is no one sure shot way of choosing a doctor. Being in the medical profession, we have an advantage that we can always ring a colleague. So if I want to get my eyes checked, I can always ring a colleague whom I know very well and say, okay, fine, do you know in your hospital a good ophthalmologist? And he will say, yeah, I know a few of them, this one is good, this one is no, so, whatever. Because they have the inside knowledge. Okay. Now, unfortunately, for people who are non-doctors, they don't have the privilege of finding out this inside information. They have to rely on the other methods. One of the most important, time-tested thing that even now what works is the word of mouth. Now, the word of mouth is where your friend has had a surgery with somebody or seen a doctor who's treated her well. That is like a first-hand experience. But having said that, your friend might have had a different condition and she would have had a different mental setup when she went through that. So her perception of, it's like saying you go for a movie. I say it's a good movie. Hopefully it should be a good movie. You will like it as well. You might not like it at all. So it again based on your personality, your situation, your condition, your friend's words might not really be applicable to you. However, if there are many friends who are saying you that, so let's say in your circle you say, I've been to this doctor and she's good. Oh yeah, I've been to this doctor as well, she's very good. And you have 10 people saying it, then it's like saying a movie is a hit. 10 people are coming out and saying, oh, the movie is really good, really good. I'm sure this is a good movie, right? So word of mouth it's an age-old concept. So I don't think previously anybody went to a doctor without checking if somebody in their relatives or friends or family circle had gone there. So that still works very well. But having said that, nowadays there are many doctors. It's not like you're living in a small town and there are only 2 doctors and you can choose between the 2.
The choice is easy, yeah.
The choice is much more difficult because you have many more doctors. You have many more hospitals. You have younger doctors with more advanced skills. You have older doctors with more experience. So you're kind of, confused more. It's a good thing you have a choice. But the choice is so much that you're confused as well. And I always feel that, yes, you find out from your friends if they know the doctor. Read up about the qualifications. Yes, if you're going to a doctor, you need to know that the person is actually qualified to do what they're supposed to do, at least on paper. Now, having had a degree or putting up a certificate saying that I'm trained to do this, that's only the beginning. So we all get an MD, we all get certified to do practice gynecology, but some of us are different. Some others are different. So we are all not of the same cadre. It's like saying you pass your degree and you come out. Each person flourishes in his own way. So similarly, the same thing happens with doctors. And there are some doctors who are updating their skills, some doctors who are not, some doctors who are more knowledgeable. So yes, you need to have but you can't go to a quack.
I agree.
So if you want to have a laparoscopic surgery done, you can't go to a person who doesn't even have a certificate.
Sure.
So you need to find out that the person is qualified. So that goes there. Then comes the thing about Google reviews. So nowadays, almost every doctor who's well versed has reviews. Okay, very few people who don't have reviews. Out of them, how many reviews are fake, how many reviews are valid is a very difficult thing to do. So you have to take it with a pinch of salt. When I try to buy something or when I try to go to a restaurant, this is my husband who's a very, I'm a very positive minded person, always eternally hoping everything will be good. He is a kind of a person who's always cynical, looking for something that's going to be wrong. So he always checks the negative reviews. Okay. Now, if the doctor has had a lot of positive reviews, you are reading about it, and then she has had 1 or 2 negative reviews, or a few, comparatively the percentage of negative reviews are less. And the negative reviews are probably something to do with, I was waiting for the appointment for too long, or something, something not really relevant to the clinical skill of the doctor or whatever. Then you can take the positive reviews as the good ones. But if you've had negative reviews which are saying that, this happened, that happened, and there are many of them, then you probably will have to look into that as well. So it's weighing the reviews also. It's not like just reading the first 5 reviews and then just going and seeing a doctor. And also reading when the reviews have been written. If there are reviews which have been written about 5 years back or 1 year back and nobody has written anything after that, you'll have to question why. So there is an art to reading the reviews as well.
True.
And then choosing between the most advanced doctor who is very young or choosing between the very old but very experienced. Again, there are two things to it. If you have a surgeon who is very, very experienced and is older, yes, he's probably a very good surgeon. So if you have a young doctor who has come out with robotic surgery skills, your experienced doctor who's older might still be a better doctor than getting the most advanced robotic surgery. But at the same time, old does not always mean gold.
Correct.
Some old doctors are very outdated.
Yes.
And some young doctors might not be that experienced, but they're very up to date and they're very earnest and then they're doing a good job.
Correct.
So you again have to...
It's your personal choice. You
can't go by old and young.
Right.
You have to go by what skills they have, and again, look at the reviews, again find out about family and friends who have visited them. You'll have to make a decision. But eventually the only thing that helps anybody make a decision is, including me and all my patients who come and see me, what I've seen this happening day in and out is, you meet the doctor irrespective of the lack of medical knowledge you have, irrespective of not having any tools to assess the doctor. You sit in front of a doctor, the doctor starts talking to you, you know that you've reached the right doctor, or you know that you've reached the wrong doctor. Correct. For yourself. Correct. I'm not saying the doctor might be right for somebody else.
Sure.
But you get that.
You feel that vibe.
You feel, you develop a trust.
Yes.
You understand, you feel that the doctor understands what your situation is. So that is what eventually helps to make a decision. That's the intuition. Now the intuition is based on scientific facts that your brain is assessing and analyzing like an AI. The speaking tone of the doctor, the mannerism of the doctor, the emotional connect that you're getting, and when they're talking about any surgery or anything, the confidence that they're showing, all that is being assessed by your brain without you realizing, and then it tells you, I think this doctor is good, go for it. Very rarely will you be wrong.
Correct, I agree.
So I think eventually it comes to that point of time where you're sitting, you've done all the groundwork. It's like, again, read about the reviews, speak to your friends, everything, and then you go for the movie. You sit there and you say, oh, fantastic, I like watching this movie. So that feeling is what eventually counts in making the choice.
See, I'm with you on this. But I'll tell you what, we have so many doctors around, especially let's talk about Dubai. There's one doctor for a surgery, he'll charge you, say, 20,000. The other doctor will charge you 30,000. We tend to feel that the 30,000 one is the better one because mehenga hai better hai. And so, how would you approach the situation?
So in Dubai, it is not so much of a matter because Dubai, most of the patients are covered by the insurance.
Yeah.
So they don't really have a choice to choose between the doctor who's 30,000 or 20,000 or whatever. They just go to the hospital that they are covered and they choose the doctor.
Correct.
But yes, in other places like India and America, I suppose, the person who is charging more probably is perceived as the person better. Person who's probably doing it freely might be, they might think that, oh my God, he's just doing it freely. Probably he doesn't have any patients.
क्या experience के लिए कर रहा है, कुछ भी कर रहा है, हाँ.
वो भी हो सकता है. Part of it might be true as well. Okay.
Correct.
But the charges that are levied on the patient is not just for the doctor's skill. It depends on where they've opened their clinic or a hospital. If they're in the high-tech area, they're charging you the rent and whatnot.
Okay. Rent, water, electricity, and
everything,
all of that.
Which you might not really be deriving major benefit from that.
Sure.
And nowadays, especially the big corporate hospitals, they're charging you not just for the medical care, for the 5-star amenities that they give you. So you will have to look at it as, okay, you have a doctor or a surgeon who is working in a smaller hospital, but the hospital is nice and clean, the equipment is all good, the doctor is good, and the basic healthcare that they're providing is fantastic. They have all the safety equipment in place. Then you are only paying in a bigger corporate hospital extra money for the other amenities which are 5-star rather than just the skill of the doctor. So that is something as well. But Dubai, it's not a major issue because, as I said, you get to go to the hospital where you are covered.
Correct. Makes sense. Now, today, a lot of people also Google their symptoms much in advance before going and seeing the doctor. If I have a stomach pain and if I'm, for instance, feeling bloated or something, I'll just try and go on ChatGPT, my stomach is paining, I'm experiencing some bloating, etc. And that is a doctor in itself. It'll tell me all my symptoms, all the possible things that could have happened to me, and it'll also prescribe me things. How reliable is Google?
I'll tell you an example. My son had recently, I think he had flu. Okay, they keep having. So what I do is, he lives in the UK. So UK, you will have to get to the GP to get any medication, and they're very lazy people.
And
so
it takes a very long time to get
as well and all that. So
things, yeah.
What we tend to do is to give him some medications which are like antibiotics and for the cold and Panadol and whatever. And we say, okay, fine, this is for you for the next 6 months. If you need anything, just take it. And I actually label everything. Okay, this is this, and this needs to be taken this many number of times for this particular symptom. Okay, so that, because they're not doctors,
Correct.
so I don't want to confuse them.
Correct.
So everything is labeled in a separate plastic pouch.
Correct.
And with a chit inside it. Okay. Now my son rang me about last month or so, and he said he was in a bad. The sound of his voice was really bad. I said, "You're not well. Are you taking medications?" "Yeah, but I don't have the medications, you see." I said, "What happened to the antibiotics that I gave you?" He said, "I went through the ChatGPT, Mama, and it said some weird things, but I don't have any of those." I said, "You have a doctor in the house who has labeled the medications for you and given it to you, and you're still checking on the ChatGPT." He said, "Oh, I didn't realize that. Hang on a minute. Which is the one you're telling?" "Okay, look in your bag." So he looked and he said, "Oh, I've got this." I said, "Take it, please."
No,
So
that's true, yeah.
To some extent, the ChatGPT or the Google might give you some information, but the relevance of all the information that's given by the Google or the ChatGPT is correct. There is no wrong information given. What is wrong about the information is the relevance. You have tummy ache, you feel bloating, it could be a stomach upset, it could be your premenstrual symptoms, it could be cancer ovary, it could be cancer in the gastrointestinal tract, your intestines. So then you don't know where to put the relevance of this particular symptom into. That's where the doctor comes into picture. And that's where the investigations come into picture. And there are people who will kind of take medicines advised by the Google and the ChatGPT, and sometimes it might work. and they might get away without seeing a doctor. But sometimes they might miss out on important things which should have been investigated earlier. So you can read any amount you want on the ChatGPT or Google, but don't rely on it. Any symptom that does not go away within the next 2 to 3 days, better see a doctor, and then you'll get a better clarity on that.
I will also add on to this point that information from ChatGPT or Gemini or all of these AI platforms, that's aggregated information.
Yeah.
They've taken information from hundreds or thousands of examples of people, and then they are, giving you an average. कि ये इस बंदे ने बोला था. So you don't know कि exactly वो उस बंदे को वो problem थी, नहीं थी, क्या था, what, and so you're not able to perhaps even get the right diagnosis.
Yeah, and also all this information that's taken from the ChatGPT or Google does not come only from the medical websites. It comes from general websites as well. So there are a lot of people who are dishing out information about medical topics which they have no idea about, they have no knowledge about, but everybody is dishing out advice.
Correct.
How to manage this, how to manage that. So all that information is also gathered and it's diluted. So if you want to, like for example, I had this Instagram thing. There was this guy who, I think it's an AI modulated voice because it's like very confidently talking about, wearing bra in the night causes breast cancer. Did you know this? And blah, 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 blah. I mean, I know wearing bra in the night does not cause breast cancer. But for a moment, even I was like, hang on a minute.
Are you serious?
The way it was being said was so authoritative.
So authoritative, yeah.
I said, hang on a minute. Is this actually something that I have missed out and I'm not telling my patients?
Sure.
I went and checked on the medical, PubMed search to find out. And then I said, okay, there's no relevance to that. So people, when you're searching for medical information, you need to search on the medical websites.
Correct.
Not on a general website. So you might, on medical website, at least you'll get some relevant information. It will tell you it could be this and that, but it will eventually tell you need to go see a doctor.
Sure, of course it does. I mean, the point is very valid. Now let's talk about something that a lot of people do is they go for second opinions.
Yeah.
And sometimes they go to third, fourth, fifth, sixth opinions and so on. They keep oscillating and sometimes they go to every doctor and don't do anything about the problem, or they end up choosing the first one that they went to. Just tell me, I mean, I wanted to shed light. Should patients always seek a second opinion?
If you're not satisfied, if all your doubts are not cleared and you're not feeling confident about the diagnosis or the treatment that's given to you, you should take a second opinion. There's no doubt about it. Even my patients, I tell them, whatever I explain, I say to them, if you're not happy with what I've explained to you, if you think that, I haven't been able to solve all your queries, you can seek opinion from anybody, it's okay. I mean, I don't mind. There is no such thing like I'm going to get offended by just because you went and saw somebody else after seeing me. I mean, I would even look at it as, what was that I did not actually help you resolve that you came to me? And I will probably look into it as next time, maybe when somebody comes, let me do this. Fortunately, I don't have that many patients who go away from me and take second opinion, or maybe I'm not aware of them because they don't come back to me. But majority of the patients who, I'll tell you my personal experience, majority of the patients, I'm a surgeon, gynecological surgeon, so majority of the patients who come to me have already been to 10 people.
Understand.
They have a fibroid, they have endometriosis, they're shopping around trying to look for a doctor. And in true sense, they are not really shopping. They haven't been able to get convinced about the treatment that is being told for them. Okay. Now, everybody wants to improve their health. Nobody wants to be wasting time going from one doctor to another. Time, money, effort.
Sab kuch.
It's not like सबको ही solution चाहिए.
Of course.
इसको sort out करके जिंदगी आगे जिए.
Yes.
So nobody, even the most irritating or a person who's asking you 100 questions and not making decision, an indecisive patient, even she wants to solve her problem. It's not like she wants to live with her problem.
Of course.
So why do they keep doing that? Is because somebody fails to understand what they're going through. And there are a lot of options. The other thing that I think you were mentioning about is different doctors give different opinions.
Yes.
Okay.
Yes.
Now, if somebody comes to me with a fibroid, there are about 4 options that I can give them. You can do this 1, 2, 3, 4, 5. Okay. Now, it is very important, especially when I was training in the UK, we were taught to talk about informed choice. Informed choice is the patient is informed about all that is available, and then she makes a choice of what she wants to do based on her personal wishes. So, doctor's job is to make sure that the patient help the patient make an informed choice, not to push your opinion onto them. Okay. So, you go to a hotel. You ask for the menu. He doesn't come and dish out with palak paneer or whatever. He says ये सब available है, आपको क्या चाहिए?
Correct.
तो अगर आप बोलेंगे कि मुझे ये चाहिए, then he'll say मैडम ये स्पाइसी रहेगा, आप खा पाओगे और ये स्वीट आएगा. तो he tells you that. So then say हाँ स्पाइसी है तो मुझे नहीं चाहिए, तो स्वीट है तो नहीं चाहिए, मुझे थोड़ा स्पाइसी चाहिए. So it's exactly that. So a doctor is somebody who should be able to explain all the choices, tell about the pros and cons, and then the patient decides based on okay मेरे लिए ये वाला सूट होगा.
Correct.
मैं ये करेगी. Then the doctor can tell हाँ शायद आपके लिए ये सूट होगा, या शायद these are the things that you might, from my understanding, this might not actually suit you. So that way, and you can encourage the patient to think about it. Okay, why is the doctor saying this will not suit me? Give the reasoning for that. If somebody says okay ये मुझे सर्जरी नहीं करना, मैं ये कर लेती हूँ, या सर्जरी कर लेती हूँ, ये नहीं करना, then I'll say देखो आपको ये करने से ये प्रॉब्लम हो सकती है, आप or you are aware of it. Informed choice is all about you accept the consequences of that, good and bad of that particular treatment.
Sure.
So उसको देना, वो information देना
that's
the doctor's job,
responsibility,
not to make the decision for the patient.
Sure.
So what I do is, majority of the times what happens with the doctors is that they have a fixed thing in their mind. Patient came for this, 1, 2, 3, 4, 5, you need to do this. And the moment the patient says, doctor ye nahi karna hai, probably that's a better option for the patient, but doctor ye nahi karna mujhe, then the doctor is almost like ego is offended. I'm telling you, you're supposed to do this, and you're going for the treatment which is lesser than this, which is not suitable for you. You need to find out why does the patient not want to do the best treatment, why does she want to do the second treatment which is not the best for her. What are her limitations, conditions that she's making her choose this one.
Sure.
So that is not answered. So somebody says, I say you require surgery. Doctor डर लगता है. My question is, tell me what exactly are you scared about.
Okay.
If you tell me what you're scared about, I can explain. Is that thing to be scared about or not to be scared about?
Is your doubt valid or not?
Okay. So most of the times patients are scared about death.
Yeah.
Surgery.
Death or pain, etc. Recovery.
Yeah.
Yes.
But the main thing is the death, which nobody wants to utter the word death. Okay. Now I tell them, in modern surgery, with the modern antibiotics, equipments and everything, the chance of a patient whom we are doing a planned surgery, who's fit and well, dying on the table is almost impossible.
Correct.
I'm not saying that it is impossible.
Yeah.
It can happen. And I tell them, in my 30 years, nobody has died under my hands. That is enough proof to say that you. So death is not what I'm thinking for you.
Sure.
That is that you have to be really unlucky. I have to be really unlucky for you to die in elective surgery. So exclude death from your top reasons for being scared. Second is people are scared of anesthesia. I might not wake up. Same thing, I tell them, it's so advanced nowadays that it doesn't happen that patients don't wake up from anesthesia. Okay. The second thing is they're scared of pain. Now, pain, we have lots of ways to manage pain. Pain is hardly anything that you need to be scared of. And the pain that they are scared of, in fact, I've seen these patients dealing with pain very well after surgery. It's only the thought of pain that is making them scared. Actual pain is, they're able to deal with it. The body has a capacity to deal with certain amount of pain with medication. So when you start thinking about all these things and all the other complications, I tell them what can happen. They're all rectifiable complications. I'm not saying that complications will not happen. It can happen, but they can be rectified eventually. You might lose out on time a little bit. You might lose out on money. You might have a little bit of distress trying to sort out all this, but eventually we'll sort it out. So what else are you scared about? So this is what I go through. Is the moment the patient says, I'm scared, I said, tell me exactly what you're scared. I try to dissect the whole thing out. Then I ask them, what else are you scared? So that is where patients start feeling, okay, fine, I know now what I'm getting into. And I tell them that unless they are 100% sure, they should really not be jumping into the surgery.
Totally.
You take your time. Unless it's cancer, any other thing, you take your
Correct.
time. You ask me 100 questions. You come back 3 months, 2 months, 1 year, 2 year. The day you feel like all your doubts are solved, then you do your surgery. Now, many times what happens is, one, as I said, is the ego of the doctor.
Yeah.
Second is the knowledge sometimes could be lacking about what updated treatments are available. So doctors might not give all the choices. The third thing is, I wouldn't say that's the common thing, but rarely doctors are driven by making money. So if you advise surgery, that you could make a little more money. So there's a possibility that they might be advising surgery for that reason. Fourth thing is, doctors may not advise surgery because they don't know how to do it. That is also a problem. So they don't want to tell the patient that that's the best option for you. They will say, "नहीं इसको कोई ज़रूरत ही नहीं surgery का, आप ये कर लो." So all these doctors' personal preferences and egos and knowledge and skill and moral and ethical values come into picture when you're trying to do this. And I feel the patient who's sitting in front of you actually knows when you're talking the honest truth. I tell my patients, I'm like your nukkad wala tailor. We all go to one tailor who fits your proper, आपके लिए सही है नहीं सही है वो सब बताएगा. So I'll tell you all the treatments, and then the patient asks me what is suitable for me. आप बोलिए doctor. I said you can choose any of them. By choosing this is the pros and cons. But I personally think आपके लिए ये वाला better है because 1, 2, 3, 4, 5. So then the patient feels, so when will you agree with anybody? When they actually understand what your requirements are and present you with that. So let's say now you get a dish which is like really very well made, but it's a little too spicy for you. You don't like it. When I give you the same dish a little less spicy for you, this is exactly what I wanted. So you need to cater to the needs of the patient, personal circumstances of the patient. This is where that human touch and the one-to-one feeling. I see so many fibroids and endometriosis. They're the commonest things that in my clinic. But every fibroid patient gets a treatment advice based on what she or her situation demands. So no one patient is like, I could like a robo just say, okay, fine, this is for you, this is for you. I could just dish them out like that, but that's not what happens. And also the confidence with which you speak will come from the experience that you have had.
Correct.
And that actually will show in the tone that you speak and what you say. So eventually patient says, I get this most of the times from my patient, almost always. Doctor, we read a lot of reviews about you and we really wanted to see you. And when we came here, we felt that the reviews did less to you. That is the feeling you want to generate in a patient.
Of course.
When they come to you. Not, we read a lot of reviews, but we went to see her and it didn't, she was not like what was described. So that is where I think choosing the doctors comes from.
I also, wanted to talk to you about one other thing, that sometimes we resort to choosing those doctors whose opinions resonate with what we want to do.
Yeah, most of the time.
Yeah, most of the time.
Yeah.
So it's like, I want to avoid surgery. So I'm going to go to every doctor.
Yeah.
Every doctor is, imagine I've been to 7 doctors, 5 out of 7 doctors have told me surgery is important.
Yeah.
One doctor says, listen, I'm going to treat you through XYZ medication and so on.
Yeah.
And we say, no, let's do that.
Yeah, yeah.
How, in such a situation,
how
should one, how important is it to actually rely on what the majority is saying and not, just go with someone who speaks your language?
As I said, unless it is cancer or life-threatening thing, then there is always a choice. Like for example, let's say for an example, person suffering from fibroid or endometriosis. Surgery probably will give a quicker relief and a better relief. But medications might help to control the symptoms. Now, if you're really scared of surgery for whatever reason, or if it's inconvenient for you to do the surgery at this point of time, you might opt for medication. So when I counsel the patient, I tell them, this is the best treatment for you. Now, if you don't want to do that, there is no force. This is the next best treatment for you. But this is what you will get out of it. Then this is the next. You decide what you want to do. You don't have to decide it today. You go home, think about it, decide. A lot of patients of me whom I have advised surgery have gone on medications because they don't want to do the surgery. They've gone on medications for about 2 years, 5 years with the bleeding problem. And then every time they come to me, doctor, kya kare abhi? मैंने बोला आपको तो बोला है सर्जरी आपके लिए बेस्ट है, बट आपको करना नहीं है, तो चलिए मेडिकेशन लगाते हैं. तो दैट हैज़ हैपन फॉर 2 to 5 years एंड देन इवेंचुअली दे कम एंड से डॉक्टर अभी बहुत हो गया, अभी सर्जरी कर लो, अभी हो गया, इतना टॉलरेट नहीं हो पाएगा. देन आई डू द सर्जरी. देन दे टेल मी डॉक्टर आपने पहले फोर्स क्यों नहीं किया हमें करने के लिए. आई सेड फोर्स कैसे करें, बिकॉज योर माइंड हैज टू बी रेडी टू बी एबल टू एक्सेप्ट द चॉइस दैट आई एम गिविंग यू.
Correct.
So as long as you're not harming the patient by giving a lesser choice. So there is nothing like, you're taking medication, your symptoms are controlled, little bit of suffering you have, but you're managing with that. That's okay. But if I'm giving you a treatment in which this is going to turn into something else and then it's going to get more complicated and risk your life, then that's the wrong treatment.
Correct.
Then I should be forcing you to say. So some of the cases I will tell them that, look, you need this. You cannot not do this. You don't want to do it with me, it's okay. You want to go check it with 5 doctors, it's okay. You don't want to do it today, this week, it's okay. But in the next month or 2, please get it done wherever you want to, it's okay. So this is what I tell them. But doing it is a must. You get it done in this country with some doctor, another country, some other doctor, does not matter. But please, for my sake, do it. So when you say that, I think they do understand.
Correct.
That this is something that, and there are patients who come to me, they've been advised surgery, they come to me and I say, look, you don't really need surgery at this point of time.
Correct.
And that way they're very relieved then. Oh, we also, because they also feel like, itna kuch problem hai nahi, surgery क्यों बोल रहे हैं? So then when you tell them, हाँ उतना problem है नहीं, they're like, हाँ okay.
The trust builds.
Yeah.
Yes, like, Well, thank you so much, doctor. We have talked about such interesting things, and for everyone who's watching us, it is very important that you go consult the right doctor for your opinions. And yes, sometimes doctor shopping is not a bad thing unless and until you feel confident and you feel like, yes, this doctor is saying something that resonates with your mind. And but it is also very important to not just rely on technology and Google everything up, and that can sometimes prove detrimental as well. With that, thank you so much, everybody. We'll see you very soon with another podcast, and please do subscribe to our YouTube channel, Womanaari with Dr. Usha Kiran, and we also have our Instagram channel which is called Womanaari too. Thank you, doctor.
Thank you.
Thank you.